Hello again. Welcome back to the Better Together podcast. I'm your host, Mike Baker. I'm excited to share this conversation with you this week. We're meeting with Mark and Sherry with the Disability Action Center Northwest. The conversation really just centers around humanity and how everybody has something going on in their life. And when we just move past that and recognize the humanity in everyone around us, how much better life can be. So I hope you're going to enjoy this episode. It's a lot of fun. I really am grateful for them coming. So we're going to just get right into it. All right. Well, Mark and Sherry, thank you for being here today. This is going to be a great conversation, and I am looking forward to learning something. That's one of the things I love about doing these interviews is I get to learn lots of new things from our guests. So before we get into it all, let's talk a little bit about like what the Disability Action Center does, and then how'd you guys end up in these cool roles that you have and doing the work?
Well, Disability Action Center Northwest is one of somewhere around 400, give or take, centers around the country that are characterized by being run by people with disabilities. They're nonprofits. Majority of board members have to be persons with a significant disability. So it's kind of a nothing about us without us program. And so we have some core services we have to do. Our primary funding is through Health and Human Services now. It used to be Department of Education. And so we get a direct federal grant. We have one actually that comes to Idaho for North Idaho, and then we also have one in Spokane for Northeast Washington. So we do a number of services, direct services for folks with a disability, any kind of disability, any age at any age of disability, and or any age of person with a disability. Basically, I often talk about have kind of a two-pronged approach for our primary services, and one's working with individuals. We do information and referral to anybody with or without a disability in the area, because information's power. When you know the right information and where to go with it, then a lot of times you've solved a problem. You can do your own stuff, and that's what we're all about is helping you do your own stuff. It's not our life, it's yours. So we get those tools. So. Independent living skills training is another one. Not just activities of daily living, but all of those things that we do to be independent. Learning how do you vote? How do you register to vote? All of those things that sometimes folks with disabilities have not had access to, or they didn't think they had the right to have access to, or have been told that. Peer counseling, which is kind of one of the unique ones of the centers because we're run by people with disabilities, we have a unique opportunity to connect with each other and kind of get that understanding out of the way. We've been there, we understand. So now let's talk about the barrier and how we can resolve that. And then probably the real cornerstone is advocacy. Working with people so that they learn self-advocacy and they become great self-advocates. And then looking at systemic barriers, and making changes that affect everybody. So that's kind of our core services with individuals. But then, as mentioned, the systems advocacy, and then community awareness training, disability awareness. We do trainings on the Americans with Disabilities Act, Fair Housing Act. Basically anything that can help a community and community members, businesses, service entities have a better understanding of disability and some of the things that affect disability and some of their obligations under some of the laws. So that's kind of in a nutshell what we do. Then we have some specific programs. We have a transportation program in north central Idaho, basically because nobody else was doing the most rural areas. So we actually get funds from ITD that we subcontract out to provide services to folks in the most rural areas, so that at least they have something for public transportation. Then we also operate the Northwest ADA Center Idaho, which is Training and Technical Assistance on the Americans with Disabilities Act. It's a subgrant through the Northwest ADA Center out of the University of Washington. We have a contractor down in Boise by the name of Danagover, and we're really tickled with that. That's one of my personal passions.
That's great.
I love training on that. And then we, as I mentioned, the systems advocacy, and then community awareness training, disability awareness. We do trainings on the Americans with Disabilities Act, Fair Housing Act. We have a contractor down in Boise by the name of Danagover, and we're really tickled with that. That's one of my personal passions. I love training on that. recently added, well, we have a Medicaid program, self-directed in-home services under Idaho Medicaid. And we recently became a provider with the Veteran-Directed Care Network, which is really cool because it's a rubber meets the road service for veterans that, again, we just love. A veteran is set up as their own company. They have their own EIN, employer identification number. They get a budget from the VA, and our coordinators help them develop that budget, help monitor the budget, and help them purchase the services to stay in their own home. And they can actually hire their spouse to provide services, paying up to $20 an hour, or sometimes with VA approval even more than that. So it's really awesome.
Wow.
Allowing veterans to stay in their own homes. So that's another service that we started. So we've got a lot of things going on.
That's amazing. That's great. Sherry, talk to me. So what do you do, and then how did you get into this?
Well, I am not originally from here. I moved out here because my dad had Alzheimer's.
Oh, okay.
And
Yeah.
I wanted to take care of him, and I was looking for a job. And I did a lot of working with the homeless and domestic violence victims. And when I moved here, I thought, no, I'm not going to get into people services anymore. It was a lot. It was very heavy. And here we are.
Yeah, that's right.
I mean, it's just,
Once you're in, you're in,
that's
right?
it, and I'm in. So I met with Mark, and he hired me, and I actually celebrated my 7th year
Wow.
this week. So
Congratulations.
it's been a huge blessing. He's a great director. His passion just leaks out to all of us.
That's fun.
It's awesome. But what I do in the Post Falls office, there's quite a bit. We do a lot of advocacy. We get a lot of phone calls for housing, affordable housing. We get a lot of phone calls for service animals, emotional support animals. What's the difference? Can I have them? We get a lot of phone calls for, there's a lot of mental health on the rise. So we deal a lot with peer support on that end, just sort of, oh yes, there's resources out there, we can get you connected, that kind of thing. I've got, I think now 3 peer support groups going on.
Wow.
We've got another one going on that we start at the end of this month down in St. Mary's. And it's for people with disabilities. And I don't know if you're familiar with peer support, but
Yeah,
it's...
we love it. It's such a great tool.
It's
Yeah.
great. It's great. And just day to day, it's, to sit here and say, this is what I do every day. I can't tell you what I do every day because it
different every
varies.
day.
It's
She does a
different
lot.
every
I
day.
love that.
And it's very rewarding, but it's also the fact that we've empowered. I was working with a woman that had a son that was in a group home, and she wanted him out. He wanted to get out, but they wouldn't let him out. He was autistic, and et cetera, et cetera. So we worked very hard, and I can happily say he's home
Wow,
and goes to
that's cool.
school and just living his life the way that he should be. So
That's got to be so rewarding.
that is so
Yeah.
rewarding. It's one of my success stories.
I love it. Well, when you guys are talking to people in the community, what's something that people generally just misunderstand about even just the term disability or disabled? How do you reconcile that, and how do you help people understand, what that means and the impact that has on people's lives?
We run into a lot of misinformation or misinterpretation. Number one, starting with our name, the federal act called them Centers for Independent Living. So everybody thinks somebody lives there.
Oh, yeah.
So we always, that's the first thing you have to say, well, we're not a center where anybody lives. We're an advocacy center, an educational center. That's it. When it comes to disability, I think the biggest thing that we try to push, certainly I try to push, is disability is not a charity issue. We're talking about life issue. Every one of us, we live long enough, we have a disability. That's the only choice, or you're not there. And so it's a common issue and a common thing we share. And so getting people to understand that it's just a natural course of life. And also that perception that somebody with a disability, and this is really important in the medical community, somebody with a disability's life has value. There's a tendency to look at somebody with a significant disability from folks that aren't familiar and think, well, they must not have a very good life. Life must not be all that good. So maybe, we heard it during the pandemic, the whole issue of with triage. Well, maybe we should, if somebody has a really significant disability, maybe we wouldn't treat them quite as quickly as some, because of the quality of life aspect. And so dispelling that stereotype is one of the hardest things, but one of the most important things I think we do. And that's, I think it's gotten better.
Good.
But you still kind of run into that. You realize that life is precious no matter what you're dealing with. So,
do you think it just comes from people's somewhat lack of awareness or understanding of what it is? I mean, somebody may look or act or do something that might not fit in the normal context of what they're used to, and that creates a little bit of fear. But I mean, is that how you interpret it, or how do you see it?
Well, excuse me, I'd agree, yes. I do know that in our center there is, I get phone calls saying, well, I don't think I have a disability, but I have depression and anxiety, and I'm on these medications. I'm like, well, okay, we have a disability,
So we're worried about the term itself, right?
Right. And, it may not be visual, but it's still there. And they still deserve the same, opportunities and the same treatment and the same resources that somebody, like maybe in a chair or whatever. So that's one of the things that we, some of the phone calls that I get, I may not be physically have a disability, but I do suffer this. And
we have a society that values perfection. That's
right.
Our actors look different in Hollywood than actors in other countries, where you'll see people that are a little bit more real. We've got that history where you've got to have perfect body. There's some great stories of it. There was a woman by the name of Bree Walker who became a newscaster, a very attractive, very capable newscaster, but she had a condition where, as she called it, people talk about lobster claws. It's a hereditary condition. And they required her to wear gloves when she had her first job, though it had nothing to do with the job.
Right.
And then the outcry from people when she was on a talk show in Los Angeles at one time, when she was having children, because it was hereditary condition. Oh my God, how could she dare to have children? That's reprehensible. Sheesh. And so on. And so we have that attitude in our society that has kind of continued to percolate. And so it's what we're up against. But again, I think we're making headway because of some really outspoken advocates that have really kind of set the tone, and people coming out more and saying, yeah, I do have a disability. I do have a health condition or something.
That's great. I love that. I mean, I think there's been a theme on a lot of the episodes that we've had as we talk to people about awareness, and again, talking about things, normalizing it. Like we have lots of humans around us, and every single person is dealing with something. It may be a disability. You may not call it a disability, but I mean, everybody's got something going on. And just the more human we can be with each other, like how nice would that be?
Yeah, a community is only the same when it's one person. And frankly, even I have fights with myself, so I don't know.
That's right. That's a little boring.
But yeah, it's everybody's a part, and the fabric of society is very diverse. Yeah. And the best thing we can do is celebrate that.
I agree. I mean, it's just like that's what humanity is all about: different ideas and different people. And I love how you talked about just every life has value. I mean, I don't want to sit in a chair where I'm the person judging whether that is true or not, right? My job is to just love my neighbor and take care of people, and that's all I'm going to do. I love how at the start of this you were talking about like empowering people to move through that. So I imagine, and I've heard stories, right, of just this is scary. I mean, when something like this happens, whether it's from childhood or life changes and you end up in a chair or with a disability, that's got to be a scary moment. And previous episodes, we've talked a lot about isolation and what that does to people. Let's talk about like the hopeful side of like the empowering. Do you have some stories and anything you want to share about, someone you've worked with where you've just helped them kind of do it? I mean, you talked about the kid that got, back home, which is amazing. Let's talk about that for a minute.
Well, I recently have a consumer who found himself in trouble. And anyway, he's a double amputee.
Oh, wow.
Very young man. And I met with him this last week to talk about, we also have a transition program, which is to assist them, people that are in, a nursing home, to get back out into the community, into their own apartment and whatever that looks like. And I was a little nervous meeting him because he's so young, and I had never dealt with that before. I didn't know the right words to say. I didn't know how to make him, encourage him. I had no idea. Because I felt discouraged for him, frankly.
Right, yeah.
I did. And so I did. I met with him, and he was amazing. He was amazing. He was sitting in this chair. He double amputee up above the knee, and I was waiting for him to be sad or upset or angry. Nope. He said, Sherry, I just need your help to figure out how I learned to live like this.
That's cool.
And I'm like, well, okay, this is what we're going to do, and it's going to be a process, but he's very excited. He calls me 2 or 3 times a day. But that's okay.
Yeah.
That's okay. As long as he keeps that, going, and that excitement, he's going to be just fine. He just needs, and he said this. He said, I just need to learn how to live this way than
great.
I did before. So
What a great way to reframe it, right? I still have a lot to do. I just have to adapt to the current situation. I love
Yep.
that. That's great.
yeah.
On the national side, if we talk about sort of empowering people and communities, I mean, where's the work? What needs to happen right now as a community? How do we do a better job supporting people in our community in this space?
Well, I think getting back to learning to be community is probably one of the first things. We're wound really tight these days.
We are.
And it spills over. We just had a information received yesterday that a statement put out by the Council for the U.S. Department of Justice that's questioning, asserting that none of the work of the Americans with Disabilities Act or Section 504, the landmark pieces of legislation that offered protections for people with disabilities from discrimination, that one of the things, we had a decision with the Supreme Court called the Olmstead decision that said services should be provided in the most integrated setting possible. Not so, says the Council now. They said there's nothing in there that says the integration was ever a part of it. So these are the things that we're kind of facing on the national level that we constantly have to be vigilant about. In Idaho, we have a large Medicaid budget. And so the tendency has been to look at the Medicaid budget and say, well, that's too much money. It's out of control. So rather than say, well, why are so many people on Medicaid, and is there something else we can do? Instead, it's, well, we have to cut programs. We have to cut. And so now we have situations where people can't find people to help them stay in their homes. They can't find a personal assistant and so they're looking at nursing home placement. Idaho doesn't have enough nursing home beds.
Right.
And it's far more expensive. So if they don't have beds, then they would have to look at, well, what do they have to pay for out of state? And so on. So it's those kinds of things that are kind of short-sighted that really are not part of community.
Yeah,
so I think that's the biggest
look at it on a
barrier.
spreadsheet, and it's like, oh, well, we could save some money here. But then you go to the actual life that's impacting, and it doesn't generally make sense. I mean,
quantitatively or qualitatively.
Right. Yeah.
that's the whole point.
No, I get
It's
that.
kind of silly sometimes. But yeah, it's kind of people don't look
It's like, let's reframe this a little bit.
deeper.
I like it's sort of like the person you were talking about. Here's the situation. Let's figure out how to do it.
Sure.
You mentioned before we started recording, you work a little bit with our street medicine program. Talked about how, because I mean that's a whole nother aspect of life. Living without a home and the social situations that a lot of people find themselves in. You talked about Two Feathers. It's one of the coolest people around.
It really is.
How have you guys interacted? What does that look like?
We just have, if they can't help them over there. First of all, I love the fact that they've got that day program.
Isn't that great?
That people that are unhoused can go and just kind of hang out. I love that. But when they are ready for maybe to find housing or something that maybe they don't have time for, they can't, they'll send them over. They'll have them call me, and then I can work with them that way. Or somebody will call me and say, hey, I need some mental health, or I need therapy, or I need something, and doesn't have anything, or need something right away, then I will send them over there to street medicine.
That's great.
We just kind of work in
Yeah.
Together.
I say that's the fun part about the nonprofit group in town. I mean, we all are pretty good at a couple things, and then you bring in this village to start taking care of people, and I think that's what I've really appreciated about just being here in this community. We're divided a lot more on social media and online than we are in person.
Exactly.
You get people in person and you talk at a soccer game, or you sit around a campfire. The humanity is still there. Sometimes I think we just have to remind people of that, and that the world really isn't what you see on social media. Sure, there's ugly things happening, but people generally are good and they care about people and want to help. Sometimes we just don't know. When you guys think about the next few years for the work that you're doing, what gives you hope? What gives you some excitement about change happening? Because a lot of people are down right now. It's really easy to look at the way things are shaping out in healthcare, in the disability space. Funding's being cut. Lots of things are being challenged. It's reshaping our world. But I still wake up every day and have hope for healthcare, and I'm sure you guys do too. What do the next few years look like for you?
Well, one of the things I'm really excited about we operate under a thing called the independent living philosophy, that whole sense I mentioned, nothing about us without us. We're our best experts on our own lives. We have a lot to offer each other, and we can do things that nobody ever thought we could. We talk, the father of independent living, a guy by the name of Ed Roberts, who was a ventilator-dependent quadriplegic, was turned down for services by the California Department of Rehabilitation. And 15 years later, he ran the Department of Rehabilitation in California. What I'm excited about right now we live in an area here in the Northwest where I think is really cool, because we have, depending on your count, at least 5 sovereign nations, tribal nations in the area. One of the things with independent living and our whole philosophy is just that word, independence. It kind of suggests, and we've talked about that a lot in our society, we suggest people are independent. Nobody's independent. Really, it's interdependence. What we're talking about is having control, your chosen level of interdependence. So we have a staff person who's a Spokane tribal member, who we've sponsored to be part of a national cohort, and they're coming up with new language. So they're talking about indigenous interdependence and talking about who do you want to connect with? How connected are you with your spiritual world, with the natural world, and with the people you want in your life? And so that's really so I see that as bringing in people from various groups that we really have not had a great track record of connecting with. So I'm excited about that.
I love that.
Yeah, I think it's really cool, because I think everybody has something to offer. And I love what you said about when you actually talk to people and talk about what they believe, what their values are, and not what something they've been told values are, then you get a different story. And when we can build up. And so I'm starting to see that. We have different groups connecting. We're kind of getting that opportunity and seeing that. Let's build something. Let's not stop at that point of how well can we define our victimhood.
Yeah.
What instead do we want to see? What are our next steps? What's the world we envision? For me, it's a place where I love having people from different backgrounds, different religion, because I can learn. It's a great experience. So I want to celebrate everybody, and then let me celebrate too. When you do that, it's not a matter of acceptance. It's not a matter of tolerance. It's a matter of celebration. Wow, what a cool thing we've got that nobody else has.
Exactly.
And so when you get other groups, and so the philosophy we're under is for everybody, and so that's really an exciting thing. I'm seeing some great things happen with
I
that.
love that. I mean, that is we just need an extra dose of that in all of our community, right? Just recognizing the value of everybody. And if you just, nobody cares who you voted for, all that stuff, it doesn't matter.
Right.
Just come back to humanity. And when you sit down with somebody, I mean, you can have such powerful conversations, and you see that the world is a really great place. I think, I feel like sometimes we're at these crossroads with, AI and all these other things that are happening. It's this could really help humanity, or all the other movies that have written about the doom of society.
Sure.
But I think we're in this place, and I think we have to, and like you're saying, we need to make this active decision to embrace the humanity of it.
Yes.
And like, how cool is it that we have access to all of this knowledge and we can bring it together and solve really cool problems? We can't lose the humanity in that
Right.
process, right? And make it happen. I think, I look in the healthcare space and what this technology can do. We've been let down by technology many, many times. Also, you look at what it's done to start to create cures and provide hope. And so we just have to find that space. I love it.
Yeah, I don't know that we've been let down by technology. I think we've let ourselves
That's
down.
true. That's a great way to
or
say it,
we've
yeah.
been let down by somebody else defining technology.
Yep.
When we define things from that human level, what we all truly care about and the values we have, rather than somebody's ability to make a profit on it,
Yep.
then I think it's
I
a
agree,
totally
yeah.
different story.
Totally, yeah. I mean, that line up into the profit driving the decisions is a big deal. But
Yeah. I mean, there's a level that you've got to have, but there comes a point when is more necessary.
It's true. Yeah. No, I think that's powerful. Do you guys what's the best way for people to connect with you? I know you're getting lots of phone calls, and I'm sure after this episode runs, because we have so many people that listen, they're going to be calling you. But what's the best way to get a hold of you? We'll put some of that information in the show notes as well. But when you're out talking, I'm sure you have cards, but what's the best way to find you if you're sitting here listening and you wonder about, the work you're doing?
Sherry, how can they contact you?
Take it away.
I'm in the Post Falls office, and want my phone number?
Sure, you can put that on. Yeah.
That's 208-457-3891.
Great.
And we are on Mullen in Post Falls.
Perfect.
We have a very robust social media presence. So we're on all the platforms. We have pages for Post Falls. We have an office in Moscow, so we have a page in Moscow. We have a Lewiston office. We have an office over in Spokane. So we have social media pages for all of those
great.
offices. Instagram, Facebook. Don't know that we do much on X right now. We did do some things on Blue Sky, but Blue Sky's been slowing down. We have a YouTube channel, DAC Northwest, where we have some videos on kind of a mental health toolkit for folks.
Great.
So some of their own information. We also did a series of videos kind of pointing at some accessibility things. We knew we couldn't make fun of people, but you can make fun of zombies.
It's true.
So we have a whole "Don't be a zombie" thing.
Oh boy, I'm excited to watch it.
Yeah,
Yeah.
and healthcare part, we just showed this to some healthcare people yesterday of the importance of effective communication.
Right.
And so we actually have a zombie doctor trying to write a note for, it says, and that didn't work. And so then he tries to sign and drops a finger, but it does get a sign language
Cool.
interpreter. So anyway, and then our website, www.dacnw.org.
Great.
And our primary number in Moscow office is our head office, 208-883-0523.
All right. That's amazing. I really appreciate you guys coming on today. I mean, this is, again, another one of those topics that we're all trying to wrestle with in societies. How do we provide the best outcomes? How do we participate in the best outcomes? And I think you nailed it right at the start of this. Like, it's all about just building community and raising awareness. Like, this doesn't have to be a challenge. Like, yes, having a disability can be challenging, but it doesn't have to be the challenge. And I appreciate you sharing the story and giving all of our best from here. I mean, we want to see everybody be successful. So thanks for being here today.
Thank you.
It's been a great conversation.
Yeah, thank you. Appreciate
Thank you
it.
for having us.
All right. Well, stay tuned. We're going to have a great conversation next week. I hope you enjoyed the episode, and we'll talk to you later.